Chapter 21, Poisoning and Overdose Emergencies, starts on page 574. So poisoning. A poison is any substance that can harm the body. The harm it can cause can result in a medical emergency. Common poisonings include medications, petroleum products, cosmetics, pesticides, plants, and food. The effects of a poison, they can harm the body based on just the nature of the poison or just on how much is taken. Sometimes it's the route it enters the body, the patient's age, weight, and health. All of this plays into whether this product or substance is going to harm the person. It can cause damage to the skin and tissues from contact. Sometimes it can cause suffocation, or you can have localized or even systemic or global damage to the body systems. Poisons are classified by the route in which they are taken into the body. They can either be ingested, inhaled, absorbed, or injected. EMT's own home and squad building should be child-proofed against poisoning. This is one of the things that we need to be really preventive about, because the best way to deal with a poisoning is to not have it in the first place. So share your poisoning prevention information with members of the public during school visits and community outreach programs. The classification of poisons by the route of entry: they can be inhaled, sprays, cleaning fluids. They can be injected. Certain drugs are injected. Ingestions, they eat, absorbing them through the skin. And even there they have a picture of some of the plants that you can absorb toxins through your skin. Kids may accidentally eat or drink a toxic substance if they have something that looks quite yummy. Some of the cleaners, nice bright green colors or fluorescent, attract kids, and they may want to try to taste them, thinking it's like Kool-Aid or something good that they can drink. Adults, often it's accidental, but they can also have deliberate medication overdoses, so that can vary. Patient assessment: what substance was involved? You need to look for the container. You need to check the labels. You need to transport this substance with the patient to the hospital so they have that information, so they can call poison control also and figure out what the substance remedy is. You want to know, when did the exposure occur? Quick acting poison requires faster treatment. ER personnel need to know that what it is, just so they can test it and treat it appropriately. You need to know how much was ingested. So if it's pills that they ate, estimate how many missing pills by looking at the prescription label and when it was filled, how many are supposed to be in there and how many are actually left. Over how long of a time did the ingestion occur? Treatments can vary. Was it something they ate little bits over a time frame? Was medication just taken for the first time, or maybe it was taken chronically? What interventions have been taken? You can look for treatments on the label, or you can sometimes look for other home remedies. Sometimes people have syrup of ipecac that they treat with. Some people try to take some type of substance to milk, might help to dilute it a little. And then, what is the patient's estimated weight? This becomes important when you give activated charcoal, and also it's kind of tells you the rate of onset of toxic effects. It's all related to the patient's weight. What effects has the patient already experienced? Nausea, vomiting. Do they have an altered mental status, abdominal pain, diarrhea, chemical burns around the mouth, and any unusual breath odors? Food poisoning can be caused by improperly handled or prepared food. Symptoms of that would include nausea, vomiting, abdominal cramps, diarrhea, and fever. And it can occur within hours of ingestion or even a day or two later. Activated charcoal. Activated charcoal is what you give a lot of times for ingested poisons. Look on page 581. It gives you all the actions, the dosage, how to administer. It is not an antidote. What activation does is it absorbs substances. It allows it to attach it to its surface, but it prevents or reduces the amount of poison that's absorbed into the body because the activated charcoal is absorbing it, and then it'll pass through the body. Many poisons, but not all, are absorbed by activated charcoal. Medical direction will determine whether the use of activated charcoal is appropriate or not. Activated charcoal, there's two things that people used to use for ingested poisons: activated charcoal or syrup of ipecac. Now, traditionally, syrup of ipecac was preferred treatment for poisoning, and we used to carry it on the ambulance. It induces vomiting in most people with one dose. However, the problem was it has the potential to make the patient aspirate, and it only removes less than 1/3 of the stomach contents. So it really wasn't as effective as what we once thought. Diluting the substance. Sometimes an adult should drink 1 or 2 glasses of water or milk to dilute whatever's in their stomach. Children should drink 1/2 to 1 full glass of water or milk. Water might slow the absorption, but milk may soothe a stomach upset. Frequently, this is advised for patients who, if they're determined by medical direction, do not need transport. So if it's somebody that they think that'll be okay, and they will advise them to maybe drink milk or water to dilute it. Antidotes. This is thought of as a substance that will neutralize the poison or its effects. There's really not very many antidotes in existence. There is one that we give now to people that have taken narcotics. Naloxone, it's called. It directly reverses narcotics and the effects, the depressing effects that they have on their level of consciousness and their respiratory drive. So naloxone is also called Narcan. And if you turn to page 583, you can see naloxone or Narcan and how it's administered and what its actions and side effects are. So, for an ingested poison, you want to gather information quickly. If they've ingested a poison, it provides another reason to avoid mouth-to-mouth contact if you're going to be doing CPR. So provide ventilation through a pocket mask. Call medical direction on the scene or en route to the hospital and let them know what the substance was that they ingested. If directed, administer activated charcoal. You may wish to administer the medication in an opaque cup that has a lid with a hole for a straw. If you take a look at that picture, that black substance coming up in the straw is activated charcoal. It looks like tar. It tastes like charcoal. It's pretty difficult for somebody to drink. So position the patient for vomiting. Save any vomit that comes up. Have suction equipment ready. So, I want you to think about your own home. Is it safe for small children? Are there any potential poisons within 3 feet of the floor or behind unlocked doors? Are there household cleaners that look like juices and drinks familiar to children? Practice child preventive practices. Keep your house safe. Can flavored children medications be mistaken for candy? What sense does a small child typically use to identify things? By mouth, always. Next is inhaled poisons. Common types of inhaled poisons include carbon monoxide, ammonia, chlorine gas, agriculture chemicals and pesticides, and even carbon dioxide. For inhaled poisons, your number one concern is your safety. Approach the scene with caution. Use protective clothing and self-contained breathing apparatus if it's required. If you're not trained or equipped, call for additional resources. Don't take this alone and become a casualty yourself. If you can, remove the patient from the poison. In the presence of hazardous fumes or gases, wear protective clothing and self-contained breathing apparatus, or wait for those that are properly trained and equipped to enter the scene and bring the patient out. Signs and symptoms of inhaled poisons: difficulty breathing, chest pain, coughing, hoarseness, dizziness, headache, confusion or altered mental status, and seizures. You want to know what substance was involved. What was the exact name? When did the exposure occur? Over how long a time were they exposed to it? Did anybody do anything? Any interventions? Did they remove the patient? Did they ventilate the area? What effects is the patient experiencing? So once the patient is moved from an unsafe environment by trained and equipped personnel, you want to detect and treat immediate life-threatening problems, or do your primary assessment and treat them. Perform secondary assessment and then a good set of vitals. Administer high concentration of oxygen, transport with all containers, bottles, and labels, and then perform a reassessment en route. Carbon monoxide is another colorless, odorless, tasteless gas, and it's created by combustion. It can be caused by improper venting of fireplaces, portable heaters, and generators, and it's a common cause of death during winter and power outages. People use space heaters and gas heaters. Signs and symptoms of poisoning by carbon monoxide are headache, especially feeling like a band is around their head, dizziness, breathing difficulty, nausea, cyanosis, altered mental status, and in severe cases, they'll be unconscious. Some fire departments have CO monitors, carbon monoxide monitors, that detect the presence of carbon monoxide in the environment. So you definitely want to see if you can get one of those checked before you enter. The treatment: patient may begin to feel shortly after being removed from dangerous environment. They might start feeling better. You can administer 100% oxygen, transport them to the hospital. It takes a lot of time to wash out the CO2, the carbon monoxide from the bloodstream, because carbon monoxide molecule will bind to the hemoglobin. It has a stronger affinity to it than the oxygen molecule will. And sometimes in severe carbon monoxide, they will try to put them in bariatric chambers to try to knock that molecule off. Smoke inhalation from burning materials can cause poisonous and toxic substances. Those of you that are firemen already know that, including carbon monoxide, ammonia, chlorine, and cyanide. These substances can irritate the skin and eyes, damage the lungs, and even progress to respiratory or cardiac arrest. Signs and symptoms would include difficulty breathing, coffee, a smoky or chemical smell in the breath, black carbon residue in the mouth, nose, or in the sputum, singed nasal or facial hair. Treatment would be to move the patient to a safe area, assess the patient, maintain the airway, provide high concentration of oxygen, monitor the patient closely, and watch for airway burns. They may be They may cause swelling of the airway, and then you're going to have an airway problem. Detergent suicides. Now, this is really interesting, so be sure and read page 588 to learn more about detergent suicides. It's a method of suicide. It started in Japan, and it's becoming a little bit more common in the United States. But what people do is they mix two easily obtained chemicals to release toxic hydrogen sulfide gas. These gases are commonly released inside a really enclosed space, such as a car, and sometimes the people will even put signs up that say suicide in progress. So scene safety is really, really important here. Exposure to fumes might injure EMS personnel. There might be a warning note left on the vehicle, but they won't always do that. And you may need to treat it first as a hazmat scene and not go in there until proper personnel come in proper attire. Absorb poisons. These can be absorbed through the skin, may or may not cause damage to the skin, but a patient might require decontamination prior to treating them. So, find out what substance was involved, when did the exposure occur, how much of the substance was the patient exposed to, over how long of a period did the exposure occur, what interventions has anyone taken, and what effects is the patient experiencing. Assess for immediate life-threatening problems in your primary assessment, and then perform a secondary assessment and get a set of vital signs. If it's powder substance on the body, remove it by brushing it off. Some of the powdered substances might react with water, so you got to get it all off first, and then irrigate with clean water for at least 20 minutes and during transport. Transport with all containers, bottles, any SDSs, any labels from the substance. Perform reassessment en route. So anything that's going to give you information on the substance and what it is. Injected poisons. The most common injected poisons would be illegal drugs that they inject with needles. But you can also put in this category venom of snakes and insects. Your Poison Control Center is an excellent source of information. In every ambulance in Illinois, it's required to have an Illinois or a Poison Control Center 1-800 number on there so that they can be called. Gives you information on poison, signs and symptoms, and treatments. Follow your local protocol for contact procedures. Sometimes you can just call medical control and they'll contact poison control. And be prepared when you get them there. Alcohol and substance abuse. Alcohol and substance abuse. Many patients whose conditions are caused either directly or indirectly by alcohol or substance abuse. Abuse of alcohol and other drugs crosses all geographic and economic boundaries. It can happen to anybody. Alcohol is a potent drug and it affects the central nervous system. It can be addictive. Emergencies may result from recent consumption or just from years of abusing it. So treat these patients as anybody else. Abuse can lead to or worsen other medical conditions. Alcohol is often consumed with other drugs. This can result in a serious medical emergency from the combined effects of them. And then you have the problem with patients that have been drinking can be uncooperative, they can be combative, so you might even have to contact law enforcement if it's a safety concern. Some signs and symptoms: alcohol odor on the breath or clothing, swaying or unsteady on the feet, slurred, rambling speech, flushed, complaining of being warm, nausea and vomiting, poor coordination, and a slow reaction time. They have blurred vision, sometimes confusion, hallucination, whether it's visual or auditory. They don't remember things. They have blackout, altered mental status. And the people that have abused it over long term have really developed an addiction to it. And when they are trying to quit alcohol withdrawal, it's the abrupt cessation of drinking, and it may cause some alcoholics to suffer from something called delirium tremens or DTs. And this can be really serious. It results in tremors, they have hallucinations, and they even have seizures. So, some signs and symptoms of alcohol withdrawal can be confusion, restlessness, unusual behavior, hallucinations, gross tremor of the hands. They might be sweating a lot. They might even progress to seizures, high blood pressure, tachycardia. So, in your patient assessment, many medical conditions can mimic alcohol intoxication, hypoglycemia being one of them. But intoxicated patients may also have medical problems. So everybody needs to receive full assessment regardless of whether you think they're drunk or not. Vomiting is common, so be sure and wear your gloves and standard precautions that you might deem necessary. Keep the suction ready. Stay alert for airway and respiratory problems. Be alert for changes in mental status. Monitor the vital signs and treat for shock. Get a good history from the patient or from bystanders that know the patient. Stay alert for seizures and transport the patient to a medical facility. Any chemical substance taken for other than therapeutic medical reasons can be an abused substance. This includes uppers, downers, narcotics, hallucinogens, and volatile chemicals. So, a lot of substances are often abused. There's one that sometimes happens in this area. It's called gypsum seed. And those are little toxic seeds that grow just about anywhere. Uppers, stimulants that affect the nervous system. Cocaine is one. Amphetamines, people take them by snorting them, smoking them, or injecting them. Some signs and symptoms of an upper is anything that's going to make your body work faster, like adrenaline. You'll have excitement, restlessness. The patient will have increased pulse and breathing rates, sweating, hyperthermia, so they might be getting warm. That's what happens when you get worked out and excited. No sleep for a long time, possibly even days. Downers. These are things that depress the central nervous system. Narcotics are kind of downers. Barbiturates, roofies, GHB. And then signs and symptoms of this, you'll see they'll be sluggish or poor coordination. And then this is the decreased pulse and respirations. Narcotics are used to relieve pain or they help with sleep. Okay, opiates, heroin, codeine, morphine. Anything that relieves pain would be considered narcotic. And this is where you would give the naloxone, which is also called Narcan, to help reverse that. OxyContin or oxycodone is another one. It's a pain reliever. So, signs and symptoms of narcotic abuse. They'll have a slowing pulse in rate and depth and breathing. So their breathing is going to be slower and even sometimes can be stopped. Lethargy. They'll be very sleepy. Pinpoint pupils. Profuse sweating, and it'll progress to a coma. I want you to look on page 596 and go through those different drugs uppers, downers, narcotics, mind-altering drugs, and volatile chemicals. So a hallucinogen, it creates intense state of excitement and a distorted perception. This would be something like LSD, PCP, or ecstasy. Signs and symptoms: rapid pulse, dilated pupils, flushed face, seeing or hearing thing, similar to the uppers. And then your volatile chemicals, these produce vapors that are inhaled. There's an initial rush that can act as central nervous system depressant. But the signs and symptoms, they'll be dazed, disoriented. They might develop a coma, swollen membranes in the nose or mouth, a funny numb feeling or tingling inside the head, changes in their heart rhythm. And people snort these volatile chemicals. They produce vapors that they inhale, and they call it huffing. They breathe fumes directly in from a substance that has a fabric or something it has a substance in it. Bagging, breathing fumes from a substance sprayed into the bag. Your paint chemicals, cleaning chemicals. So be careful. Patient assessment, it might be difficult depending on their level of consciousness. The patient may have taken more than one type of drug. They might be uncooperative. They might be combative. Be aware of the possibility of a contaminated needle and the presence of the chemicals that can harm you or stick you. Be aware of possible airway problems and respiratory distress. Provide oxygen and assist respirations as needed, and then treat them for shock. Talk to the patient to keep them calm and cooperative. Perform a physical exam. Look for evidence of injection sites or track marks. A good picture of that is on page 598. And also here. These are needle tracks on a patient's arm, and it indicates a history of injected drug use. Another common place that people are starting to inject themselves is between their toes, because it hides the fact that they use drugs. Transport as soon as possible. Consult with medical control according to local protocols. Perform reassessment with monitoring vital signs. Continue to reassure the patient throughout all phases of care.
A poison is any substance that can harm the body, sometimes seriously enough to create a medical emergency. Once on or in the body, a poison may act as a corrosive or irritant, destroying skin and other body tissues. A poisonous gas can act as a suffocating agent. Systemic poisons harm the entire body or specific organ systems. Commonly, poisons act on the central nervous system to depress or overstimulate the brain. Activated charcoal is used in cases of ingested poisons and works through adsorption, the process of one substance becoming attached to the surface of another. Ordinary charcoal adsorbs some substances, but activated charcoal is different because it has been manufactured to have many cracks and crevices. By ingesting activated charcoal, the poisons bind to the increased surface area and are eliminated by the body.
So in a poisoned patient, perform a primary assessment and immediately treat life-threatening problems. Ensure an open airway. Administer high concentration oxygen if the poison was inhaled or injected. Next, perform a secondary assessment including baseline vital signs. Find out if the poison was ingested, inhaled, absorbed, or injected. What substance was involved. How much poison was taken in, when and over how long a period, what interventions others have already done, and what effects the patient experienced. Consult medical direction. As directed, administer activated charcoal, water, or milk for ingested poisons. Remove the patient who has inhaled the poison from the environment and administer high concentration oxygen. Remove poisons from the skin by brushing off or diluting them. Transport the patient with all containers, bottles, and labels from the substance. Reassess the patient en route. Carefully document all information about poisoning, interventions, and the patient's responses. Safety is always the first concern when dealing with a poisoning or substance abuse patient. Poisonings are generally classified by route of exposure. Effects vary greatly depending upon type of poison and method of entrance into the body. EMTs must use thorough assessment. They need to look for scene clues, help identify the nature and the severity of the poisoning. Poison control centers offer a wealth of resources to assist in assessment and treatment of the poisoning patient. Remember that alcohol is a common underlying issue with patients. In some patients, it may be the most significant problem they have. The effects of substance abuse can vary greatly based on the type of substance. Determining the type of drug ingested can shed light on effects to come. What are potential risks to the responder on a poisoning or overdose call? Think about it. What did they take? Is it something that can affect you? Are they combative? What is the route of entry into the body? What are some things EMS can do to prevent poisonings, especially in children? So, a farmer calls 911 because one of his farmhands has tried to clean up spilled pesticide powder with his hands. On arrival, you find that the patient insists he has brushed all the powder off, feels fine, and doesn't need to go to the hospital. What do you know about poisons? Is that can help him to convince him to go? Does absorbed poison happen immediately, or is it something that can show up later in life, later on in the day or later on in the week? So you need to remind him of this. What do pesticides do? Some pesticides cause increased salivation, tearing, watering of the eyes and mouth. So be aware of the absorbed poison and what it can do, and call medical control. For more about absorbed poisons, look to page 589. Find out what's going on and do the right thing. So as he talks, he continues to make brushing motions at his jeans, on which you can see the marks of a powdery residue. How do you manage this situation? Is he still touching the substance? What type of chemical is it?